Good evening, ladies and gentlemen, and welcome to the sixth in the series of coronavirus briefings that NCR has been doing on this webinar platform. Today we have the privilege of hosting two of our own staff in reporting on a set of results that have proved to be very timely and topical. So today we'll be releasing and have just released the results of the round 2 of the Delhi National Capital Region Coronavirus Telephone Survey. This was one of the first surveys that was done. The first round was done April 3rd to April 6th, and we reported the results on April 12th. The second round started on the 23rd of April and ended on the 26th, and here we are with the results of the second round that two of my close colleagues will be presenting to you, and I'll introduce them in a second. Why is this survey important, and why are other such surveys important? Policymakers at the center and in the states are truly grappling with some of the most complex decisions that they have faced probably in their leadership years. And I guess the simplest way of describing those is to say that this is the balance between lives and livelihoods. On the one hand, we have the pandemic. On the other hand, we have an economy that is at a standstill. And both possibilities are something that you would not wish on anybody. But here we are in this pandemic, and now coming to the end of the second lockdown that India has been under since the 25th of March. Both surveys that have been done, and my colleagues will go into that in greater detail, have been timed so that they would be roughly a week before the end of the scheduled close down. So this gives us a very good set of comparisons for what is happening to households in the National Capital Region. The clearest dilemma that our policymakers face is if we open up too soon, then a second round pandemic could be very costly. If on the other hand, we don't open up soon enough, the cost to the economy and the eventual recovery will be very costly. So these are the two major considerations that have led NCR, and within NCR, a unit that we call the National Data Innovation Center that has been pioneering this work and to which both my colleagues belong. And that is really what has motivated us to do this survey, and we'll continue to do similar surveys in the National Capital Region for at least another round and perhaps a few more. Let me introduce my two colleagues. Professor Sonalde Desai is professor at NCR with a joint appointment at the University of Maryland at College Park. She directs the National Data Innovation Center that I just mentioned. And of course, she's an internationally known demographer whose work has dealt primarily with human development in developing countries with a particular focus on gender and class inequalities. She's best known for her work on the India Human Development Survey, again, a partnership between NCER and the University of Maryland. The IHDS, as we call it, is going to be in its third panel round starting sometime this year, as soon as we can actually start field operations, which of course are at a standstill. Let me introduce my second colleague, Dr. Santanu Pramanik, who's the Deputy Director of the National Data Innovation Center. Shantanu has deep methodological training and interests in surveys, data quality, randomized controlled trials, small area estimation. He has worked extensively in this area before joining NCR. He was at the Public Health Foundation of India. His PHI work has led very successfully to evaluations of the studies on the impact of Health Ministry's flagship child immunization program. He has a background in MathStat and a number of other areas. We're very proud to have him with us. With that, let me turn to my colleagues. Sonalde Desai is going to lead off with some results, and then Shantanu will follow. I would urge all our attendees, participants, to please use the Q&A chat box at the bottom of your screen. If you have questions, they will show up here, and we want to save time, surely, for being able to engage with those questions. So please keep them coming. There's also a press release, which is a detailed press note, which is linked to the invitation that you would have received. If you wish to download that, you can. We've just released it this afternoon. So more details are available on that press note. And of course, the video of this webinar, as well as the presentation, will be on NCR's website by this evening. So Sonalde Desai. So unmute yourself.
You know, the first thing I want to do is start by thanking my colleagues who are part of this effort, particularly some of the people who have been managing the field work, Dinesh Tiwari, Gurpreet, O.P. Sharma, Vijay Chauhan, Abhinav Moteram. You won't believe the amount of work that has gone into carrying out this survey between 23rd and 26th of April and getting the results collated by now. And we couldn't have done it without incredible hard work on the part of my colleagues and mentorship from people like Shekhar and other members, senior members at NCER. As Shekhar led off, basically, I don't think we have any good choices. There are a number of issues that sort of face us today as we think in terms of enhancing human welfare. And those, excuse me for a second, I'm just going to share my screen while we talk. Okay. Shekhar, you may need to have me, allow me to share the screen.
You should be able to do that now.
Yes, sorry, yeah. Wrong one. Okay. As I was saying, I don't think we have any good choices. On one hand, we have disease, impact of social distancing on emotional and social well-being, impact on economy and poverty. On the other hand, we could face massive number of deaths. And I think we are all trying to make the best choices that we can in a climate of uncertainty. All we are trying to do over here is to give you some sense of what are the experiences of people living in Delhi NCR region so that it can inform some of these policy discussions. The data that I'm going to present come from Delhi NCR Coronavirus Telephone Survey, DCVTS for short, which is something where we are trying to get the pulse of the people, to get a sense of what are the day-to-day experiences of people in this region. The region for Delhi NCR stretches as far down as Bharatpur and Alwar. So we have both urban and rural districts in Delhi, Haryana, Uttar Pradesh, Rajasthan. And the data we present is for a sample of about 1,885 households. I'll keep comparing the results from the first round of the survey, which was conducted around April 3 to 6, between the two lockdowns, start of the lockdown on March 25th and the first end on April 14th. And the second survey, which was carried out between April 23 and 26, about a week before the end of the lockdown, May 3rd. So in some sense, what it shows us is sort of changes that have been occurring over time, adaptations that have been occurring over time, and yet some of the persistent challenges that have continued over time, over the period late March to now. The first round of the survey was a survey of about 1,756 people. It was a telephone survey. It lasted about 10 minutes. And there we started out re-interviewing the households whom we have been studying as a part of a long-term Delhi metropolitan area study since early January of 2019. And because we had had prior contact with them and validated phone numbers, we were able to interview 77% of these respondents. this time we are talking about different people. They are neighbors of our previous sample, so there's the same characteristics of the people, but these are people for whom we collected phone number about 15 months ago as a part of drawing the sample, but it was not a validated number. So at the moment, what we are able to do is we have a response rate of about 64%. Of that, 22% is basically wrong number, out of surveys, no incoming facility, etc. And then there are a small number of people who refuse to participate. Okay. Among the people we were able to contact, about 82% responded. So in some sense, we still retain a fairly representative sample. When we compare this particular sample with the sample on face-to-face interview, which is what we usually consider the gold standard, the sample looks fairly similar over time, with one exception, which actually is something interestingly as a part of government policy. At that point in time, only 66% of the household had an LPG gas, and now 92% have it as a part, probably as a part of the Ujjwala scheme. Let me just give you a highlight of the key results, and then we'll kind of go into the detail. The first thing we want to say is that, social distancing is something people are beginning to absorb, and they are working very hard to practice social distancing. About 64% of the sample had no contact at all with an outsider over the previous month or previous 24 hours. We also noticed substantial economic distress, including price rise, particularly for the workers who are located in informal sector. This time we asked some questions about access to safety nets, such as PDS and cash transfers and so on. And we actually think that there is a substantial proportion of the population that has received safety nets. Now, it could be that, they are living in Delhi NCR region and they are close to the seat of the power. And that's why the proportion of people we find receiving safety nets may be higher than others. But nonetheless, it's a very interesting thing to note. I'll also be showing you some data on continued support for lockdown, but it is softening at the edges among people who are experiencing most suffering. So this is something we need to take note of. The social distancing, okay? First, in this round of the survey, we find social distancing to be much more effective than in the previous round, and then even it was very high. We also find, though, that even after the lockdown ends, a substantial minority of the respondents said, oh, we'll continue to practice social distancing. Okay? So that's an interesting finding. The first thing we did was we asked people, how many people did you come in contact with outside of your home in preceding 24 hours? Okay. If you look at the orange bar, and let me just make an aside, continuously through my presentation where we compare the two surveys, the orange bar will always represent survey number 1 that was carried out between April 3 and 6, and the green bar would be survey 2 carried out between April 23rd and 26th. And what you see is that about 54% of the households said that they had no contact with anybody outside their household in the first survey. And now the number has risen to about 64%. Okay? So clearly social distancing has become much more of a norm, which is really surprising in India, a country where we are, very gregarious, and a social contact is sort of a part of our life. We live in close quarters. So to be able to practice this level of social distancing is quite impressive. It's also an impressive tribute to the amount of communications strategies that have been undertaken. How did we measure social distancing? Well, we asked people, how from the time you woke up yesterday to the time you slept, how many people were you in contact with? And a contact is defined as two-way conversation in physical presence of another person, a physical presence of another person within 6 feet. If you're shouting across 10 feet, it doesn't count. Direct contact, for example, hand holding, sharing a motorcycle or a bicycle ride, etc. And we asked about number of people they contacted outside their house through this particular kind of a definition. And if there were no contact, then we would record it as 0. And we find that 64% had no contacts. However, a substantial minority, not a substantial minority, but roughly about 3% of the people had a large number of social contacts. And those are typically people who were part of police, shop owners, people associated with hospitals and clinics, etc. A higher number of contacts also occurred at some public places like Kirana shop, market, mandi, PDS shop. So those may be the areas we may need to pay attention to in future as we go along. Very few respondents told us about contacts for any other reason, but it's also possible that this may be due to a greater social pressure to be sort of so politically correct. The next question we asked was, if the lockdown is lifted after 3rd May, what are the activities that you and members of your household would like to resume immediately? An overwhelming majority said they would like to get back to work. Substantial number said they'd like to get back to Kirana shop or mandi, school, etc. Okay. Specifically though, we also find that about 37% of the respondents said nothing. Okay, they had no response to what they want to get back to in terms of immediately after the lockdown, which does show a level of sort of hesitancy in jumping back in. Okay, I think we are seeing this in other countries as well. Lifting of lockdown in Wuhan has not really increased a lot of people walking around on the streets. Okay, so some of the social distancing is being absorbed in people's mindset. We also found tremendous impact of lockdown on livelihoods. Respondents said that the incomes have fallen sharply while prices have risen. And this is particularly relevant for people living in the red zone districts, which are most affected, as well as casual workers and households with businesses. Let me show you some numbers. Okay. We asked them, did coronavirus outbreak your income or wages in the last 2 weeks? And the options they had was very much, somewhat, not at all. Now, what we find is that a pretty large number of respondents tell us, almost 50%, tell us that their incomes had fallen very much. Roughly about 32% say that incomes had fallen somewhat. And about 19% say that their incomes had not fallen at all. Okay. This is a large number, somewhat smaller than previous survey, perhaps because people are getting adjusted, perhaps it's a different sample and different responses. But nonetheless, what we find is that a very large percentage of the population continue to suffer from low income declines. And these declines are larger in the red districts compared to the orange districts, for casual workers compared to the salaried workers, and for urban areas compared to the rural areas. And I want you to remember these urban areas because I'm going to come back to it in a couple of other slides later on. What we find is that income differences in red districts had, and you might actually remember that government, Ministry of Health and Family Welfare has classified districts in green, orange, and red. The green ones are the ones with no coronavirus outbreak, and mobility is much more open there. Orange districts are sort of in between, and the red districts, and all of you in Delhi are living in red districts, okay, is where the mobility is constrained most strictly. Our sample had no green districts because it's a Delhi NCR region. We only had the red and the orange districts. And what we find is that the income decline for the red district in the period April 3 to 6, okay, was large, but so was that in the orange districts. Now, actually the orange districts seem to be recovering somewhat because there is a more transportation available in those areas, and the gap between the red and the orange district is growing, which you can see here in this particular comparison, where the red district respondents say that their incomes have declined very much at a much greater rate than in the orange districts. The gap used to be 8 percentage point, now it is 11 percentage point. And as we sort of go along, if the lockdown continues to affect red districts, this is where some of the safety net focus will need to be. Okay. We also found that our first wave of the survey carried between April 3 and 6 had found substantial supply shortages. About 29% of the households had reported that they experienced supply shortage of essential commodities such as grains, vegetables, medicine, or cooking fuel. This number has declined sharply now, and only 9% of the population reported supply shortages. However, we asked a question this time, which we had not asked before. What are the commodities for which prices have increased post-lockdown? And we find that about half the households don't report any price increase, but the rest of the households do report some sort of a price increase, and this increase is greatest for the food commodities. Pulses, vegetables and fruits, grains are the three big groups where you see a price increase. And households which report at least one of those items where the prices have increased is about 47%. So 47% of the respondents have experienced sharp price increase in one of the food items. And again, this is something that the public policy will need to think about how to manage as we go along. Safety nets are beginning to kick in. And this was something that sort of happened between our two surveys, where government made extra effort to ensure that the PDS ration allocation has increased for people. Delhi government actually allowed access to PDS ration to people with or without ration cards. You didn't need ration card in order to be able to get the rations. Okay? And several programs instituted cash transfers. Jandan account holders were sent 500 rupees in their account, and so on. So a number of different cash transfers took place. Okay? And what we find is that about 51% of the respondents in rural areas and 43% in the urban areas, a total of about 47% said that they had received extra rations, either grains or pulses, from the government because of the coronavirus outbreak. Okay. We also asked whether you or anyone in your household have received additional cash in your bank account because of a coronavirus outbreak. And again, 28% of the respondents said that they have received some extra cash. This proportion is again higher in the rural area, 36%, and lower in the urban area, 19%. Of the two benefits, if you received at least one, either food or cash, okay, that proportion is roughly about 57%. So in some sense, actually one has to say that safety nets are beginning to kick in and are being implemented. Again, I want to note though, that this is what the results we are reporting are Delhi NCR region. They are much higher than what people in some of the other areas are finding. And it may be that, people in Delhi NCR are living close to the seat of the power and are much more likely to receive the benefits than other areas. But we can only report what we are finding, and that seems to be quite substantial. Okay. Proportion of households, though, that received both benefits is only about 19%. And again, we see a big rural-urban difference in favor of the rural areas. Okay. Now remember, I had told you that we divided up our sample in the people whose incomes had gone down by a lot, somewhat, or not at all. And we find that the people whose incomes had gone down very much, this first bar in each set, okay, are the people who are most likely to receive rations or cash benefits, whereas people whose incomes have not gone down at all are less likely to receive rations and less likely to receive cash benefits. So in some sense, yes, it is pro-poor kind of transfer that's taking place. Part of it has to do with the fact that the transfers that are taking place are based on prior enrollment in some of the DBT programs, such as, holding a ration card, being registered because of Narega program, having a Jandan account, and so on. Okay. At the same time, okay, these benefits are relatively modest. Okay. Cash benefits are only about 753 rupees at a median amount, and mean amount is about 1300. And there is an urban exclusion in it. This is something I kind of want to stress now, okay, is that what we find is that people whose incomes went down significantly, okay, in urban areas, there is still roughly about half the people who are not receiving any kind of benefits, which is something that is worth worrying about. Okay. At the same time, income declines have occurred much more in urban areas than in rural areas. Let me highlight this. Okay. 53% of the urban households say that their incomes have gone down very much compared to 47%. And yet they are much less likely to receive any kind of extra rations. 51 rural versus 43 urban. Receipt of cash transfers, 36% rural versus 19% urban. I think rural advantage is part of our past policies, where rural areas were much poorer than urban areas and were deserving of many of the DBT transfers. But in the current climate, the urban exclusion is something that we need to worry about. I think I'm going to stop here and turn over to Santanu to present some of the more occupationally disaggregated data. Shantanu, I'm going to stop sharing my screen so you can start sharing now.
Shantanu, unmute yourself before you start. Shantanu, we're only seeing a list of files, not your presentation.
Okay, sorry, let me.
There you go.
Now?
Perfect. Thank you.
Okay. Hi, good afternoon all. Good evening, actually. So before I start, I would like to echo Sonal's thought that I'd like to acknowledge the contribution from our team members, because as you can imagine, I mean, 2 consecutive surveys which are completed in 4 days, and the reports are out immediately after the survey is done. So tremendous level of planning, questionnaire designing, field management, and data cleaning preparation went into it. So it would be, and also the guidance we received from Dr. Shah and others at NCAER senior management is just simply amazing. It would be injustice not to mention that before I start. So now
you can be unjust, Shantanu. It's all right.
Okay. So now you've got a sense of some of the findings and implications from our study as presented by Sonal. But what we wanted to do, we want to, and we know from round 1 and as well as from round 2 that the impact of coronavirus, rather the impact of lockdown, is quite disproportionate. It depends on where you live, like rural versus urban. It depends on what type of work you do, what is the main source of income of the household. So in the next few slides, we would like to unpack this particular issue and see what is the level of differential impact of this crisis. Okay, so the first slide is on the type of on the different sources of income of the households we have in our sample. So we have collected this data through two sources. So on one section we have questions on, so basically key four type of households we wanted to capture. So the households engaged in cultivation, households have a business, however small or large, or households have a regular, I mean, someone in the household have a regular salaried job, and does anyone in your household work as a daily wage labor. But here you can imagine that one household can have more than one source of income. So along with these variables, we have another variable in the socio-demographic section where we have asked about the main source of income of the household. So we have combined these two sources of income, and if there is a discrepancy, then we took the response we received from the socio-demographic section. So that's how we tried to categorize the household based on their main source of income. And as per that classification, so this is the sample size and the distribution, the percentage of different households in our sample. So 36% salaried workers, 22% sort of households involved in cultivation, 20% business, casual work, laborer, 18%. And others include rent, remittances, pension, etc. So, I mean, as you can imagine that more disaggregated level we go, the sample size goes down. So we have to be careful the inferences we draw, but this is the distribution we have in our sample. Okay, so the reduction in income, it depends on the kind of work individuals do. And the households whose primary source of income is casual labor, which can be either in agriculture casual work, or it can be non-agricultural such as construction work, etc. They are most, so like more than 70% of casual workers or the households having casual work as the main source of income. They mentioned that 72% of those households mentioned that their income was reduced substantially. And the owners of businesses are also not far behind. And if you compare the casual workers, the bar here, where the income is affected very much, with some others such as the business owner and the salaried worker, there's a significant difference between the two estimates. So that kind of suggests that, I mean, which is understandable because of lack of work, I mean, their income would decline. So that's something we have seen in round one as well as in round two. Now, coming back to the salaried workers, so here we have seen that, I mean, you can imagine that the income loss may not be apparent for the salaried workers in the middle of the month, because when we went to the field, when we conducted the survey, the second round survey, it was April 23 to 26. So then asking about income loss in the last 2 weeks, so that may not be apparent income loss to the salaried workers. So that's why what we have done for salaried workers specifically, we have asked whether they have received their March salary during the lockdown or not. And 62% of the salaried workers reported receiving their full salary, but remaining 8%.
Shantanu, just to correct, it's not the March salary, it's the salary in the last 30 days, right?
No, Dr. Sir. So only in this section, for the salaried workers, we have asked about March salary. So
okay, all right. Thanks for the clarification.
Yes. And the remaining 38%, they either did not receive any salary and or received partial salary or lost their job during the lockdown. You can see on the right the breakup here. So 10% received partial salary. 26% they did not receive any salary, and about 2% they lost their job during lockdown. So So you can see that the salaried, even within salaried workers, I mean, more than a third actually suffered some kind of income loss. Although overall, when we see that the salaried workers are much less affected compared to the casual workers, but it's salaried work is a fairly heterogeneous group of workers. So we have to keep that in mind. Okay, so you have seen in the first figure I presented about the income decline, the farmers, they have been the least affected, and only 33% of the farmers actually told that their income has declined substantially. And we also, I mean, it seems that they are somewhat protected so far. Could be because that harvesting season just started, and probably later in the phase, like at the beginning of May or even in the middle of May, we may see greater impact for the farmers. But also we need to keep in mind that the farmers actually, there are some exceptions for farmers in allowing for greater mobility that has been allowed. So probably that is helping, and other factor is that the harvesting has not been completed in some parts of Delhi NCR. So that's why they are not that affected, but transporting and selling crops has posed some challenges for some of the farmers. So 12% of the farm households reported some difficulty in getting the produce to the mandi. 11% had no problem, but you can see that 77% had not tried it. So basically it says that, I mean, this is too premature to comment on the level of the impact on farmer households. So we may have to see what happens after a couple of weeks or even after that. Okay. And another important aspect is, since we know that that impact since we are aware of the impact on income, there is a substantial decline in the income. Now, the safety nets plays a very important role in helping the households to cope up with this crisis. And we have seen that access to safety nets, it actually also it probably, as Sonal mentioned, that it actually helping the people who are most in need of it. So here in this graph on the left, you see that the casual workers, they received ration the most, additional ration. Here we throughout the study, throughout the questionnaire, we have used additional ration. It's not the ration they are supposed to receive through the usual channel. So it's the additional ration that was allocated because of this lockdown, because of this crisis. So they received maximum ration. They received either ration or cash. They received maximum cash. They received either of the two. Also, the percentage is much higher for the casual laborer. So as Sonal mentioned, that access to safety nets in an emergency depends on being part of some safety net program, and casual laborers, particularly in rural area, I would say, they are often part of the schemes through which many safety nets are delivered. So that probably explains the rationale behind the maximum access to the additional rations provided during this time. And these channels could be like the UP Narega cardholders got access to PTS ration, direct cash transfer was made to Jan Dhan account holders, the women Jan Dhan account holders, and also Jan Dhan accounts used for Narega payment as well. So these channels are helping the casual workers to get access to this additional ration or additional cash benefits. So we know that the income reduction is the maximum among casual workers. 72% of the casual workers was affected very much because of this lockdown. And how, so we'll see, and Sonal mentioned earlier also, we'll see later as well, that there is a tremendous support for lockdown, extension of lockdown. However, for casual workers, it's only 48% actually supported the lockdown strongly, whereas 62% of all households supported the lockdown strongly. So it's much less. So just looking at the overall figures of the support for lockdown doesn't help. So we need to sort of look at different levels to find out what's going on across the population. And 63% of the casual workers actually mentioned that they will immediately go back to work. They would like to resume their work if the lockdown is lifted after 3rd May. And it is much higher compared to the 55% of all households who mentioned that they will resume the work immediately. And safety net we already mentioned, but one thing I would like to point out, even though the casual worker received the additional ration and additional cash, at the same time 30% of the casual workers did not receive additional rations in spite of their need for it. So that is something that requires some attention, and continuing and enhancing these safety net measures will be necessary if the lockdown is to continue in some form or other going forward. Now, coming to this particular issue of lockdown, I mean, it remained consistently similar. I mean, so during our first survey, what we have seen, during our first survey, we have seen that during the 21-day lockdown, when they were asked that whether they would like to, what is their opinion about extending the lockdown after this period of 21 days, there was overwhelming support for that. Even now, when after 3rd May, if the lockdown is extended, whether they would be, what would be their opinion? Here also we see sort of large level of support for lockdown, but it is softening at the edges. As I also mentioned that for the casual workers, we have seen that only 48% is actually supporting lockdown. So yeah, so both these surveys were conducted about 10 days before the end of the lockdown. So when asked about support for continuation of the lockdown for an additional 2 weeks, a vast majority of respondents, they are willing to support it if required to extend for another 2 weeks. So here is the comparison between the round 1 and round 2. So you see that the percentages remain more or less the same. 63% in round 1 who strongly supported extension of lockdown. It remained about the same in round 2 as well. Here we compared the red districts versus the orange districts and between the 2 rounds. So what we have seen in round 1, that 62% of the respondents who lived in the red district, 62% strongly supported lockdown during round 1, whereas this percentage has gone down significantly. It's now 57% in round 2. So the respondents from red districts, 57% of the respondents, they strongly supports the extension of lockdown. Is that percentage has reduced from 62% to 57%, which kind of suggests that the restrictions they are facing because of the more COVID-19 cases. So that's kind of leading to a change in their attitude towards extension of lockdown.
Shantanu, if I could just interject, you go back a slide, please.
Yes.
So the red districts in DCVTS 1 and 2 may not be the same, right? They may have changed.
No, so they are the same, Dr. Shah. So basically,
they are the same. Okay.
The 12 districts we have in round 1, it's exactly the same in round 2. So only change happened is that the new households have been selected, but the districts and the clusters, so clusters are essentially the NSS, UFS block, urban blocks, and the census villages. Those remained as it is. Only the new random sample of households were selected.
Okay, great, thanks.
Yes, and yeah. So here we also brought another dimension here where we have looked at the households whose income have declined largely or somewhat income declined somewhat, or there was no decline at all. So when we bring that dimension, we see that between round 1 and 2, so there is a decline in strong support from 62% to 56%. So the households whose income declined largely, so earlier the 62% of them still supporting the extension of lockdown. But now 56% of such households are supporting extension of lockdown. So it's sort of, I mean, getting into them that it's the extension of lockdown is actually it's affecting their income and affecting their well-being to a large extent. So that is kind of reflected. So the point I'm trying to make is that although the overall support for lockdown is relatively higher, but there are levels at which we see that attitude towards lockdown is also changing over time. Okay, so we know that if we compare the situation of the disease in India with the situation in other countries, it's very different, and the number of cases are much lower compared to some of the other countries. So in Brazil, it took about 14 days to go from 1,000 cases to 28,000 cases. In Russia, it took 19 days, whereas in India, it took about 29 days. So basically, there could be a tendency to underestimate the virulence of the disease, and that we actually see when we compare the perception in the risk of getting infected by coronavirus, which actually, so 76% of the respondents, they see no chance that they or their families might get infected, which is an increase from 65% about 2 weeks ago. So basically during early April, we have seen that 65% of the respondents saying that they don't have any chance of the respondents and their families, they don't see any chance of getting infected. Now that percentage has gone up to 76%. So it could be that people are following social distancing because of that. It could be that it's a complacency that they have not been infected so far. So it's about more than 2 months since the disease sort of came to India in a greater form. I mean, so it could be combination of both. So there is a chance that we might be underestimating the danger of the virus. So that's something to keep in mind, and how our policymakers are going to handle that is going to be very crucial. And this is a graph that Sonal presented earlier. So on the right side, this is the exact graph that was presented earlier. So 55% told that they would go back to work, and 37% they mentioned that they will not resume any activities the way they used to do before lockdown. Okay. So here what we, on the left side, the 2 bullet points we have. So those who strongly supported extending the lockdown, 43%, they said that they will not resume the usual activities. So that's higher than the 37% we see for all the respondents, okay? And those who did not strongly support the lockdown extension, this percentage is much lower, only 28%. So again, the point we are trying to make here that we have seen that the percentage of respondents who wants to go back to work is much higher for casual wage worker. And the percentage of people who don't want to resume any activities, that also depends on your attitude towards the lockdown. So that's guided by that. Okay, so I think that's all from my end, and over to Sonal about some of the policy issues.
Thank you, Shantanu. So what do we take away from these results? It's very clear that I think I think there's a universal agreement that we are dealing with a very difficult situation where day-to-day choices will have to be made about the pace of the virus, how do we respond, what kind of policies to implement. So let's think through a little bit about the potential policy implications of this particular work. Okay. The first one is, I think that we are very clearly going to have to think about safety nets and livelihoods for people who are at the bottom of the distribution, particularly casual workers. But I suspect other categories might also come into play over time if the lockdown gets extended, particularly in areas like Mumbai and Delhi, which are hotbeds of sort of virus spreading. Okay? So what can we do? Well, in some ways, of course, we have an interesting opportunity for rural areas through finding ways of doing MGA and REGA work that can be done relatively safely, including working in one's own farms. Okay. We don't have any such opportunity for doing it in urban areas, but we may need to think in terms of what kind of urban activities that can be done. So for example, there is a shortage of masks. We can think in terms of sort of encouraging entrepreneurship, which allows people to do piecework from home, such as preparing masks or protective equipment. Okay. But I think we'll need to get creative to create livelihoods for urban casual workers, small entrepreneurs, and so on. We'll also need to think in terms of safety nets, okay? Particularly in terms of distribution of rations, distribution of cash transfers and so on. And also think in terms of making sure that supplies are available, that prices don't go out of control. Yes, we do know that PDS is a rural bias as well as sort of other kinds of cash distribution programs. But given that disease and lockdown are going to be greater problem in urban areas, we may need to think about sort of more urban focused schemes. We are also going to need more localized strategies. See, a lot of programs are sort of done at the state level, and yet going forward, much of the sort of restriction of mobility, lockdown, etc., we are clearly sort of approaching an attitude where we'll be focusing on areas where virus is spreading and spreading fast, and areas where virus spread has been reduced can be kind of returned back to normal. If that is the case, then we are going to need to have in place some sort of strategies which are focused at a district level and perhaps even at a more localized level, such as neighborhood levels. You know, everyone living in Delhi knows that there are some neighborhoods which actually have much greater restriction than other neighborhoods. So we may need to think about sort of more localized strategy. The moment a neighborhood is declared as a hotspot, well, immediately a supply truck should be getting there to make sure that supplies are easily available and they don't run into lack of supplies and price increases. Finally, I think that we need to find ways of clearly communicating risk. You know, we kind of have this, right now we are living in a land of uncertainty. Upper middle class as well as the poor, we sort of think that yes, the coronavirus is it's a dangerous thing, that if we get infected, it would be really bad for our health. On the other hand, we are not really sure how fast it's going to spread, how virulent it is. Okay, and sort of, and part of it has been sort of coming out of the Indian government's clear policy to sort of talk about the success in flattening the curve, rather than recognizing that some of the policies may have flattened the curve, but without it, the curve could actually be very sharp and swift. And India, there is no reason to believe that India would be that different from Turkey or Iran or any of the other countries. Okay. So communicating risk, making sure that also communicating who exactly is at risk, you know, the older people with pre-existing conditions. So I think developing better communication strategy would be something that we'll need to think about. At the same time, I do think that this is something that its situation is evolving very quickly. Everyone is making their best effort at ensuring that we act, with the nation's best interest in mind as we go along. And I think that all the changes, policy issues that I'm talking about are just beginning to emerge, and I'm sure they will get attention as we go along. Thank you.
Thank you, Sonal. Thank you, Shantanu. We've had a really very rich set of discussions from the DCVTS 2. Let's open it up for questions. We're just at 1 hour in this webinar. We have another 30 minutes. Sonal, you wanted to take some questions alive, and I think you should probably do that. Before you do that, I just want to say that here's the team that's done the work. All of them are here. I'm glad that they are all here. One of my colleagues is considered an external advisor. I'll have to find out whether she's left the institution or not, but I don't think she has. Bonali, I think you're still with us. What I did want to say is that the micro results at the household level that we have seen in this DCVTS 2 really echo the discussion we just had yesterday on the webinar, which was, of course, on the macro and growth picture, and the title was How to Protect and Rebuild the Economy. And there, the role of the states was really emphasized by all the 4 market-based prominent economists who were on the panel. And I think your notion that localized solutions are going to be really important because that's where the connection between the policymaker and the citizen is the closest. There's a political angle to that, of course, and there is the ability to respond to specific cultural and social needs. So I think this is something that I'm sure that the government here in New Delhi and in all the state capitals is thinking about. In that context, again, at the macro level, but I think there are micro and local ramifications of this. We really have to think about something we've been emphasizing, Arvind Subramaniam and Devesh Kapoor, again on a similar webinar, NCR webinar like this, have been emphasizing that the role of the interstate council or whatever coordination mechanism that in a sense has been written into our constitution, but has never really been practiced. I think this is the moment when we need to make sure that there is really a close dialogue between the center and the states. And indeed, that's possibly how we'll also be able to manage the resource issues that are underlying all the solutions that we are looking at. So let me turn to you, and whichever, you can see the questions on your screen. So you may want to pick out some of the ones that you've already answered, which I think were very interesting.
Yes. Let me start by the question from Riddhi, I think, where she was asking us, she's an anthropologist, and Riddhi was asking us whether, how did you deal with open-ended questions? Okay. The ideal thing would have been to sort of write down verbatim record the question responses to the questions that were open-ended. But we also knew that we wanted to tabulate these data very quickly. So what we did was we provided our interviewers with a set of pre-coded answers. So when somebody says, price rise, I saw price rise in wheat atta, okay, then you just put it down as sort of cereals, okay. So we had some pre-coded categories, but there were also a few things for which we actually asked them to type down the answer so that we can actually look at it. For example, the one question that we found very interesting in our first round of the survey, and we didn't have an answer to, was who are these people who meet more than 10 or 20 people in a day? Okay, what kind of occupation are they in? What are the conditions under which it happens? So those were the answers which were sort of written down verbatim, and I kind of read out some of the responses to you. We have a question from Sucharita on the class profile of the sample, and I think Santanu has kind of described it by occupational categories. But one thing I want to stress was that this sample is largely a male sample. We have done other phone surveys where we have tried to get talk to both men and women, and it's not been very easy to get a response, women respondents to answer questions on phone, largely because the phone numbers that you often have belong to male head of the household who are very suspicious of these strangers calling up. Okay. And so in this particular survey, we made no effort to ensure equal female and male representation, but this would be something that would be worth looking at in future. There's a question from Sunita Krishnan on explaining urban exclusion and whether there was an interaction between urban residents, extent of income reduction, how might the two be sort of playing out together. So, Sunita, it's very interesting. What we found was that if your income went down very much and you lived in urban area, you had about 50% chance of getting extra ration, whereas it's same answer by people in rural areas, there was a 57% chance of getting extra ration. The cash was even, difference was even bigger, where 38% of the people who experienced a significant income decline received cash transfers in rural areas versus 22% in urban areas. Okay? And I think this urban exclusion is in some ways part of the way many of these schemes have evolved over time. So for example, UP is using MG-NREGA card to give people rations in PDA shops where they don't have a ration card. Okay, well, MG-NREGA card is only available for rural residents. Okay, so there may be some confounding effect, but there is an exclusion as well. There is a very interesting question that I don't have a good answer to from Debolina Kundu. Okay. What she's saying is that what is it that people have real income declines and yet they are supporting lockdown? Okay, I mean, how do we kind of put these two together? Okay, and I think this is the problem I think everyone is facing, in that we are living in a climate of uncertainty, and about the only thing we can do is to trust the people who are supposed to know and who are in power and who are kind of making these decisions. You know, the argumentative Indian does not usually like whatever the government tells it to do. Okay, but when it comes to crisis condition, okay, at some level we don't have enough answers. Honestly, I don't think anybody could tell us today, anyone living in, say, a Chittaranjan Park can actually tell you what's the prevalence of the virus in that particular area. They can only believe that, okay, if the government says this district is identified as a red district, there must be a real problem and hence I must support it. Okay, so in some sense, it's lack of information which kind of leads us to trust people who are supposed to know. Okay, and we hope that they are making good decisions. Okay.
So to add one point, Sonal, here. So I mean, we have seen a lower level of support from casual laborers, support towards extending the lockdown relative to when you compare it with the overall estimates. But at the same time, I think you are right. I mean, there is some level of social desirability bias probably there, and which could be to be politically correct, which could be out of fear, which could be many things. So it is probably there. I mean,
or to an economist, it could be simply a marginal utility calculation that the loss of my life is not worth the additional income that I might make for a couple of days or weeks. So there are all these really serious calculations, but I do think that perhaps for the first time, certainly in our lives, we've faced this kind of a choice, and clearly people are extremely worried about permanent losses of life and livelihoods as opposed to a temporary loss of livelihood.
We have an interesting question from Priyali Sur, which says, is the lower number of cases in India has to do with lower number of testing in India, isn't it? You know, I think lower number of cases everywhere seem to have to do with lower number of testing. New York, actually, there are some studies which say that as much as 25% of New York population is infected, and yet those are not the cases that are being reported. So I suspect you're very right. and I suspect it's true for many other parts of the world. We have a question from Anjani Kumar, which is, since you have a repeated survey, why did you change the households? Why not the same households in the second round of the survey? And I think Santanu has an excellent response for this one.
Yeah, I don't know whether it's an excellent response or not, but we have thought through about this. So basically, just to give you the background. So this Delhi metropolitan area study we have been doing for the last 1 year or so, where we have been following the households. We have followed them over 4 quarters, 4 rounds before this COVID crisis hit. And after that, we followed them again in this telephone survey. So we are a bit worried that, I mean, there's multiple contacts and multiple surveys with them would add to respondent burden. And also we want to go back to them for future follow-ups as well. That's one of the main reasons. But again, we went back to them in round 1, mainly because we knew that we have validated phone numbers from them. Okay, so that was one of the main reasons we went back to them. And also, as you know, that for such knowledge, perception, and attitude type surveys, if we keep asking the same questions again and again to the same household, there's a chance of this observer bias, which is kind of known as the Hawthorne effect. So that also may kick in. So those things we had in mind. So that's why we thought, let's go back to a different set of households, because it's a random sample again from the Delhi NCR region. So it should give us a sort of unbiased estimate of the population.
And I think just on that, the challenge is going to be now in the 3rd round. We're going to have to think very creatively about what kind of sample we will want to choose, having already worked with the initial DMAS, the Delhi Metropolitan Area Study sample, and now another random sample. Perhaps we'll have to think about some hybrid or some such creative combination of those surveys. I should say that inspired by this work at NCER that we've been doing on the telephone survey, a number of other telephone surveys are also actually about to launch from NCER, including a survey of firms. We expect to survey a significant number of firms in the first round, learn from that, and then do a monthly survey of the same firms over a period of 6 to 8 months to be able to understand how they are coping. So this has led to a lot of thinking and a lot of motivation to do more work in this area, to be able to understand how industry as well is going to respond to the crisis. Sonal, back to you.
Actually, I wanted to turn it to Santanu for the next question as well, which is what kind of challenge you faced while collecting data? Are there data quality concerns? If yes, how were they addressed? It's a question from Bidu Bhushan Mahabhadra.
Okay, so see, I mean, this was telephone survey, and not only that, everything is done virtually. So the training happened through Zoom, and we know that particularly in round 1, we knew that there were connectivity issues. So even if you know that you are giving the training properly, some of the interviewers may not be able to hear or listen to you very clearly. So these type of challenges we faced, and we tried to sort of resolve those through common WhatsApp group and sort of give uniform messages to all so that they don't make mistakes. And also we wanted to make sure, one key concern we had, that we wanted to make sure that the interviewers are calling to the actual household. So for that, we used to collect their call records. They used to share the screenshot of their call records after every day's work. And we had 7 monitors from our team. So that's why the workload was distributed. Okay, so that it's a reasonable workload for one monitor. So they used to look at these call records, match those with the sample IDs, and make sure that those telephone numbers were called. So that's one of the key concern that we resolved that way. And of course, there were some issues regarding data quality, which we faced some odd values, outlier values. Then we reached out to the interviewer. We asked them, they mentioned that it's a typo, they can't remember something like this. When it was resolved by discussing with the interviewers, we have corrected the data. So, but these things particularly happened in the number of contact cases. That's the contact within house, contact outside your home, etc. Also, in terms of the amount of cash received, we have seen some odd values. We called the interviewer. If they can't explain, then we actually called the household as well, just to make sure that it's not an error on interviewer part. So yeah, so that's how some of the data quality issues have been resolved.
Um, I actually want to note here that this call record verifying that Santanu is talking about is a non-trivial work. Just think about 1,800 households. Even if there are 7 monitors who are sort of looking at it individually, they are looking at roughly about 40 to 50 call records every day. Work was going on over weekend, and it was just a very intense amount of work. We also tried to look at the data as it was being uploaded. And I remember after the first day going into a panic that somebody said that they had received cash transfers of 30,000 rupees. And I was pretty sure there was a typographical error there. And we put out an email to all the interviewers that anytime more than, 5,000 rupees worth of cash transfer is being received, please write down the conditions under which it is being done, who is getting what, and so on. Okay. That said, though, I have to tell you that telephone surveys are very difficult in terms of ensuring data quality because you're not the face-to-face with individuals, but they are equally difficult. I do a lot of face-to-face surveys too, and I have to tell you that even those are very difficult to ensure data quality because sometimes we are asking questions that your respondent doesn't want to answer. Sometimes they don't know how to answer. One of the question here is on my screen is, this from Rosa Abraham, the categorization of decline into somewhat, very much, etc. on income is very relative. And how are they comparable across responses? We don't know. This is going to be something that's going to take a longer term analysis to see, what we are getting and how we are getting it. And if I was worrying right now about a wonderful methodological study, I would actually go back to the same households and ask this question again to do some test, retest, validity, reliability kind of a thing. But this is, at this point, we are trying to do the best we can, given in the public interest, to coming out with quick data that is as believable as possible.
So look, I wanted to just pick up one question that's an important one, I think. This is Vikram Nehru, I guess, sitting in Washington, D.C., asking, a lot of these answers and findings seem very intuitive and in some sense very believable. Did we find anything that was really a surprise and that was really counterintuitive? I know this issue of the support for the lockdown, despite the decline or in incomes and the impact on businesses, is clearly one such thing that needs more probing. Other things that you can think of that seem surprising and counterintuitive? Economists, as you know, thrive on counterintuitive things.
Well, there is a counterintuitive result that I didn't even report because I'm not quite sure how much to believe it. Okay. One of the questions that has been emerging continuously is the increased household conflicts and domestic violence during lockdown. Okay. We didn't want to do a sort of a detailed domestic violence survey, but what we did ask was, is there sort of, after the lockdown, has there been more conflict, less conflict, similar amount of conflict in your households? And we basically, I think, have 5% saying more conflict, 5% saying less conflict, and the rest saying it was as it was before. Okay. And yet, in many countries, some very interesting findings have emerged in this area. So we kind of felt like, okay, we are interviewing household heads, most of whom are men. Maybe this wasn't the right question for them. Okay. So yes, there are a number of sort of counterintuitive findings. Certainly the support for lockdown is another one of those. But that, at least now I feel a little bit more relieved that we are seeing more sort of economic distribution as we might expect in it. In the first round, it was like virtually everyone was fully, totally supportive, whether their incomes had gone down or not. Okay? So at least now we are seeing some sort of a trend, so it's quite interesting. Okay. Santanu, do you have any other counterintuitive things that you would like to talk about? I think we're still absorbing the results. I also have to tell you folks that, you know, the data got finally uploaded on Sunday night, and today is Friday morning. And I think we will be looking at it more carefully over the next few days as we go along.
Sonal, did we, a question from Sanjeev Pohit about the religious identity of respondents. Did we actually ask that question? And if so, do we have any answers to that question, which I think is an important one as well?
No, we did not ask that question in this particular phone survey. For the DMAT sample, we have data from prior rounds. Okay? One of the reasons we did not ask was, I think that at some level, we are asking questions that can be quite sensitive to people, and we did not want to jeopardize the quality of other results.
Mm-hmm. So just to add, Sonal, I mean, we haven't asked in this telephone survey, but we have data from house listing.
Right.
So we haven't analyzed by religious identity, but we have data on their religious identity.
So maybe I could just explain for our viewers that though in the DCVTS 2, we did not ask the question, and 1. In 1, these are the households who are part of our Delhi Metropolitan Area Study survey. So we actually have a lot of information about those particular households. And in this case, since the second round consisted of households who were in our listing, which is the entire frame that you designed before you sample from that. In that listing, you said you have asked this question. So it'd be possible to go back, and indeed, there's going to be a lot more work to be done on this area because we have the DMAS survey, all the panel data on them, and then of course we have the listing data, which is much less than what we have for the DMAS survey. But surely we'll be doing more work on this. We have a few minutes more, 5 minutes more, and I just thought we might take up anything else that you want to, Sonal. The questions are continuing to come in, and there's really a great deal of interest in what you are doing. I'm just scrolling through to see what might catch my eye, but if you feel there is something else that we can talk about.
There is a question here that I'm going to actually respond to and make a little pitch as well. There is a question that says, have you considered doing some sort of gendered analysis, either by looking within the household or by purposive sampling of women and men? We know from previous research that impacts may differ by gender. Okay? On a personal level, I've done a lot of work on gender in the past, and this is something I remain very interested in. I know there are several members of our team who are very passionately interested in gender inequalities. We believe that it requires a different framing of questions. The way we design the questions, the kind of questions that we ask is going to need to be rethought. And it would be something that I would love to look at in a future rounds. But meanwhile, for those of you who are interested, I also have actually a web-based survey of basically middle-class households, where we have asked people to respond to questions about changes in gender division of labor in the household during the lockdown period. So I'll retweet the link, and please, if you feel like it, please respond, and we'll tell you about what's happening to people like ourselves.
So before we end, and we have about 4 minutes more, did we answer this question from Rasha Omar about whether the 55% casual workers who felt that they would be able to go back to work after the lockdown, whether there's any sense in which they feel, or are they simply hoping for the best and thinking that there will be jobs that they will be going back to? because while we are focusing right now on the perceptions and feelings and understandings and knowledge and thinking about from these households, there's the whole employer segment of society. And at some point, we'll probably have to think about, how this relates to what firms are thinking about doing, even very small firms and large firms. Sun, anything on this, or Shantanu?
This was something that we did not ask a question about. It remains a concern. It's a very interesting question. I think even no one really knows at this point in time, even people who are employed in formal sectors, as to how long their jobs might continue, given the kind of economic catastrophe that we are dealing with. But I think it's very clear that it would be a major issue for casual workers when they go back. It just is something we don't have any data on at the moment. Shekhar, you're muted.
I'm sorry. I said we're getting close to an hour and a half, and I think we have really gone quite deep into some of the questions. More work is underway by the team that is doing this work. As I said, we have more data at the background that we will be looking at very carefully. We are also on a treadmill in the sense that we are trying to make sure that a big effort, for example, here was to be able to release this data while we are still in the second lockdown phase. We don't quite know exactly how May 4th is going to look. And I suspect that surveys like this will have tremendous value even after the lockdown, because there's just going to be so much coping and so much adjustment and adaptation that's going to have to happen, and in the households, in firms, in both manufacturing and service-oriented firms. And so this is going to remain a live set of issues that we're going to have to track, and the more evidence we can bring to bear on sound decision-making, the better off I suspect we all will be. With that, let me thank Sonalde Desai in Maryland at the moment, and Shantanu here in New Delhi. I'd like to thank all our attendees. We had close to 100 at one point. And I want to thank all of you for coming. I do want to also take this opportunity to recognize that it is Ramadan, and indeed we are going to shift this time because iftar is generally around 6:40 or so, and I know that some of our friends and well-wishers who would like to have been here were not able to join us because of that. So we will now, from next week, shift the time a little bit, but I do want to wish all our colleagues who are observing Ramadan our best wishes. With that, let me thank all of you again, and this has been a very interesting session. We are continuing these webinars, at least one a week, possibly sometimes two a week, as we've done this week. So again, thank you for joining, and I'd like to thank the entire NCAER team that comes together and works on this. It's a long list. I won't name every one of them, but they all work very hard to make this happen. All the best, and to all our viewers, please stay safe. Please keep your head above water. Don't do anything that you may regret or somebody else may regret. And we'd like to see you again on this NCR webinar channel. Thank you and good night.
Thank you. Thank you, Shekhar.
Thank you, Sonal. Thank you, Shantanu.